A healthy diet can be helpful in managing weight and reducing the risk of obesity-related health problems. Here are some general guidelines for a healthy diet. Focus on whole foods. Choose foods that are minimally processed and contain a variety of nutrients, such as fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit added sugars and refined carbohydrates. These can contribute to weight gain and increase the risk of obesity-related health problems. Avoid sugary drinks, candy, and processed foods. Sugar generates more diseases in other ways. Watch portion sizes. Overeating can contribute to weight gain, so it's important to pay attention to portion sizes and aim for balance in meals. Stay hydrated. Drinking enough water can help regulate appetite and boost metabolism, which can be helpful in managing weight. Seek professional guidance. Consulting with a healthcare professional or registered dietitian can be helpful in developing a personalized diet plan for managing obesity. The recommended daily calorie intake to manage obesity depends on factors such as age, sex, height, weight, and activity level. A healthcare professional or registered dietitian can help determine an appropriate calorie intake for an individual based on their specific needs and goals. It's important to note that a severe calorie restriction or crash diet can be unhealthy and unsustainable in the long run, and may even lead to further weight gain. Therefore, a balanced and sustainable approach to calorie intake and physical activity is recommended for managing obesity.